If standing and walking causes your low back pain, you might have spinal stenosis, and the wrong exercises could be making it worse. Let's fix that. Today, we're going to be talking about spinal stenosis, including what it is, what movements typically hurt, what movements you need to be avoiding, and what you can do to help decrease your symptoms of low back pain from spinal stenosis. What is spinal stenosis? It's a narrowing of the canal that the spinal cord goes through. So the vertebrae in the spine stack up on top of each other, and all the nerves that go into your arms and your hands and your legs and your feet travel through that spinal cord. So when the canal gets narrow, it can put some pressure on the nerves and cause pain. In the case of spinal stenosis, pain is usually worse with standing, walking, or trying to arch backwards. Many people report that they feel better when they're sitting or if they bend forward. You may notice that when you go to the grocery store, you want to get a cart so you can rest your arms on the cart. That's a sign that your low back pain is coming from spinal stenosis. This is most common in adults over the age of 50, 60, and 70. I'm Dr. Amy, PhD trained in orthopedic manual physical therapy, and I believe that movement is life, and you deserve both. All right, let's understand the mechanics of what's happening if you're suffering with a spinal stenosis. So if you bend backwards and you have a spinal stenosis, that compresses or narrows the space. Whereas if you bend forward, that helps to open up the space. Anything that causes a compression of the spine will increase your symptoms, whereas anything that causes a decompression will help to relieve them. I often get asked if an inversion table is helpful for spinal stenosis. An inversion table is a table that will allow you to tilt upside down to varying degrees. You can set exactly where you want it to be, which will help to allow some decompression of the spine. Inversion tables are actually super helpful with spinal stenosis, assuming that you do not have a disc problem as well, which can be challenging because often the two can go together. If you only have a spinal stenosis, the inversion table can be helpful, whereas if you have a disc problem, the inversion table can cause an increase in your pain. So if you have not met with a specialist and you're trying to decide if you should use an inversion table, proceed with caution if you think that there might be a disc problem involved in your low back pain. With spinal stenosis, it's very important to be in the correct body position as opposed to doing things like just stretching. What movements do you want to avoid with spinal stenosis? Well, friends, I admit that this is going to be controversial because there are people on YouTube who will tell you that you should do exercises such as extension. That is any type of backwards bending. That can even be things like doing a cobra pose or an upper dog or standing back extension, which is where you're standing and you're trying to backwards bend as far as you can. I don't know why this is recommended for spinal stenosis on YouTube. I can't explain it because the biomechanics behind it are that that's going to close the area down and cause compression, which will increase your symptoms. So I understand it's a controversial statement, but the biomechanics do not support doing extension-based exercises when you're suffering with spinal stenosis. Another movement that you want to avoid is any kind of heavy overhead lifting without good core engagement. The reason why is this will cause that extension type motion, which could increase your low back pain. And I hate to say this as a runner myself, but if you're suffering with spinal stenosis, you do need to take a break from running or high level impact activities such as jumping. And I know that's not what you want to hear, but it's important in the short term to give up those activities to allow your symptoms to calm down. Will it ever be safe to return to high impact activities if you suffer with spinal stenosis? You can, you just want to make sure that you have really good hip activation and core activation to support your spine. So again, you're not getting that compression while you're doing those high impact activities. And really with exercises, you're going to want to avoid anything that requires prolonged standing without rest breaks. So you may have to switch up your gym routine and do some seated exercises along with some standing exercises until your spinal stenosis calms down. And I do understand that if you're suffering with spinal stenosis, this is not a problem that you're going to be able to heal. It is a problem that you are going to need to manage. And people can get really frustrated with that because it means they may have to give up their favorite activities for a short period of time. However, if you do all the things to make sure that your body is properly supported, chances are good that you'll be able to return to those activities at least occasionally. But it's important to work with a specialist who can understand exactly what's going on with your body and what your goals are. Now, what are some safe and supportive exercises that you can do right now? One of my favorites for my people who are suffering with spinal stenosis is child's pose. So that's where you're on the floor on your knees and you're stretching your arms out in front of you. And that really helps to open up that spine. To do that from sitting, you can simply bend forward, trying to put your hands on the ground. And again, that will allow that flexion or that opening of the low back. If you don't like being on your knees or you don't want to do it in sitting, you can also do it while you're laying on your back and bring both of your knees up to your chest. Again, that will allow for that flexion or that opening of the low back, which should help to decrease your symptoms. Cat-camel is another one of my favorite exercises for people with spinal stenosis. So that's when you're on your hands and knees and you're arching your back and then dropping it down and really getting that good motion through the spine. Just make sure that you're staying in a range of motion that doesn't increase your pain. Now, if you're looking for a really good cardio activity that you can do, you want to do some stationary biking. So that will put you in more of a forward flexed position again, and it will help to open up the spine while you can still get your cardio burn going on. And I am a huge fan of deep breathing. It's important to make sure that we are getting all of that deep breath. It also helps to decrease our pain awareness as we get activation of the vagus nerve. So the vagus nerve runs to the diaphragm. The diaphragm is the deep breathing muscle. So when we take that nice deep breath, it activates the vagus nerve. It pulls us out of fight or flight, which helps to decrease that pain intensity. And it is always important, especially with something like spinal stenosis, to discuss posture. We want to make sure that we're staying in that proper position as much as possible. So when you're sitting, you want to make sure that you have proper lumbar support that does not increase the symptoms in your body. Now, some people will think they need to be in that military posture, but truly military posture is kind of an extended posture. And that may actually increase your symptoms, but you do want to be in a supported posture so that you're not causing damage to other areas in your spine. So if you're thinking, oh, I need to put a lumbar roll or a support underneath my lumbar spine, that may not be true right now, although that does help put us in that what we consider correct posture. When you're suffering with a spinal stenosis, that can cause, again, that compression, which actually may increase your symptoms. So for you, having a little bit more of a rounding may be important to help decrease your symptoms. If you're going to be laying on your back, or what we call a supine position, you want to make sure that you have some pillows or some rolled up towels or blankets underneath your knees. Again, when we're laying on our back in that flat position, it tends to cause a little bit of an arch in our low back, which again is normal. However, when you're suffering with spinal stenosis, it can really increase your symptoms. And some people have tried one pillow and they said it actually made their symptoms worse. You may require more like 2 or 3 pillows to really get that nice bend in your knees and decrease the stress to your low back. I've even had some people purchase wedges that help to elevate their knees even a little bit higher, especially if they want to sleep on their back. And it is critically important to make sure that if you're trying to reach down and grab something from the floor, that you are bending at your hips and your knees. We do not want to be hinging through the low back, particularly if we have spinal stenosis, but really we never want to be doing that. So make sure you're using your knees and your hips to pick things up from the ground. Now, I know earlier we were talking about how we needed to be a little bit cautious with certain movements, but I don't want you to forget about the importance of strengthening. It is important to keep moving because motion is medicine and healing requires movement. You really want to focus on getting your glutes nice and strong to support your pelvis, which will help to decrease stress on your spine and tension and increases your symptoms of your spinal stenosis. So when we're talking about glutes, we're talking about the muscles that are on the back of your hip, but we're also talking about those muscles on the side of the hip. We want to make sure that our pelvis is well supported to decrease that stress on the low back. We want to make sure that we've got that good core engagement. So we're talking about the abdominals here, but we don't want to do anything that increases that extension. Again, extension is not good for spinal stenosis. So we want to be able to do that core activation without increasing extension. And I love walking as a form of regular cardiovascular exercise, but I do understand that with spinal stenosis, this can really increase your symptoms. That's why I would say I prefer stationary biking if that's available to you. But if not, then try to do regular short walks throughout the day. Now, you may be wondering, when do I know if I need to get help for this problem? If you are having pain that's shooting down your leg or numbness in one or both legs, you want to see a specialist to understand if there's something more than spinal stenosis going on. If your walking tolerance continues to decrease, even though you're trying conservative measures to decrease your symptoms, then you definitely want to seek help because we don't want you to lose your ability to walk. And what you want to look for in a specialist is someone who can look at your body and your problem specifically to create a customized treatment plan that is going to help you get back to your goals. Spinal stenosis doesn't mean stopping movement, but it is important to learn what activities need to be avoided, at least in the short term, and what you need to add in. Gentle flexion or forward bending, supportive strengthening, and postural awareness are key to managing your spinal stenosis. And I want to tell you, you can feel better and get stronger without increasing your pain. Now, if you feel that your spinal stenosis is leading to sciatica symptoms or pain or numbness going down one or both legs, I'm going to have you check out this video over here because you may be suffering with spinal stenosis that has aggravated a disc or a nerve that is leading to other symptoms such as sciatica.